let us talk about lymphoma. When we talk about lymphoma, this question, according to pathology, like in your patho paper, you can get few important things as a question. That is definition. They can ask you types, that is classification. Then they can ask you the types of RS cell. Finally, its clinical features and diagnosis. So these are the important things that we are going to see in this video. So let us begin with the definition. When I talk about definition of lymphoma, what is lymphoma? It is proliferation. Obviously, lymphoma means a tumor. So it is a solid tumor present in a solid organ. But these solid organs are specifically solid tumor which is involving lymph node. The lymph node and spleen, liver. All of these are involved. Now this is the definition that you need to know. That is solid tumor involving lymph node or spleen or liver. Now when we talk about the types of lymphoma, we obviously know there is Hodgkin's lymphoma and then there is non-Hodgkin's lymphoma. This is very basic. Let us talk about Hodgkin's lymphoma or Hodgkin's disease. When we talk about Hodgkin's lymphoma or Hodgkin's disease, we say that Hodgkin's disease, it primarily arises within the lymph node and involves extranodal site. So it begins at lymph node and then spreads to extranodal sites, right? This arises in single node and then it spreads to the spleen. It can also extranodal site. This will include spleen, liver and also bone marrow. So all of these places are involved. Now this is characterized by something called as RS cell, or we also call it as Reed-Sternberg cell. It is a classical feature of Hodgkin's lymphoma. Then we talk about the expectancy. When can we find this disease? When is it most common? It is seen generally. Okay, so we have some categories. It is generally seen in age 15 to 35 years, or if a person is more than 50 years. Right, this is the most common age where we find it. Males, it is more common than females. Also, one more point, that RS cells are derived from B cells of germinal center. These RS cells are derived from B cells. Okay, B cells, that is deep, like the leukocyte, we have lymphocyte. From there they are derived. Now let us talk about the classification of Hodgkin's lymphoma. Classification is based on the immunophenotyping of RS cells. Immunophenotyping of RS cells. So what is it? Classification we do, it is of two types. First is classical Hodgkin's disease and second one is non-classical Hodgkin's disease. This classical Hodgkin's disease, it will have RS cells which are positive for CD15 and CD30. In non-classical, which is also known as nodular lymphocyte predominant type, there is RS cells there are RS cells which are positives for CD20 and BCL6. CD20 and BCL6, and here they are negative for CD15 and CD30. So this is the basic classification that you need to know. Let us know the classification. And under the classical Hodgkin's disease, we have nodular sclerosis. We then have mixed cellularity. You have to learn all this, okay? Nodular sclerosis, mixed cellularity. Then third is lymphocyte rich, and fourth is lymphocyte depleted. Here there is only one type under the non-classical one that we have already mentioned, the nodular lymphocyte predominant. Nodular lymphocyte predominant type. We were also supposed to talk about the RS cells. Okay. So let us talk about the types of RS cells. RS cells also show different types. How many types are there? There are total 4 types of RS cells. There are total 4 types of RS cells. Everything is being divided. Everything is being classified. First is classical RS cell. Then is lacunar classic cell. Then there is polyploid type, and then there is pleomorphic. The way it appears is very important. Let me take this color so that I can show you the H&E staining. So firstly, the classical one, we see there is this outer cytoplasm, then there is obviously inner this is the nucleus that I am making. Can you see how it appears? This is how the nucleus actually appears. Okay. This is exactly how the classical one looks like. So you have to also make one when you are talking about it, and then mention few points. How does it look? When you see it, it looks like owl eye. And it is bilobed. What else can you see? It has 2 nucleus. What else can you see? Okay. Here there is cytoplasm around it. Now there is no lacunar or space anything around it, so we don't mention that, but you see that. Where is it present? Where can we find it? It is generally seen in mixed cellularity, and it is seen in lymphocyte rich. So both are the type of classical. Lacunar. Then we talk about lacunar. In lacunar, again there is this space, then this and this. What is this appearance? This is lacunar type of RS cell, which is showing pericellular space or a clear space. Nodular space. So that is all you need to know. It is seen in nodular sclerosis. It is a pericellular space. There is a pericellular space. As you can see, there is this free space around. So this is for me lacuna, and it is seen in nodular sclerosis. Then we have polyploid This is very important. How is it looking? First of all, polyploid. It has a very peculiar shape. Okay, when we talk about, so we specifically mention it is looking like a large lobulated nucleus, which looks like a popcorn. It is also called as popcorn shaped, and it is seen in lymphocyte predominant. Now lymphocyte predominant, if you can remember, it is a type of non-classical one. So the one that is seen in non-classical or the nodular lymphocyte predominant is the popcorn type. In mixed and lymphocyte rich, we can see classical, nodular, sclerosis, lacunar. Now only one is left, that is lymphocyte depleted. In lymphocyte depleted, you see pleomorphic. How does pleomorphic appear? So when I make pleomorphic, there is this nucleus of this cytoplasm, sorry. Then we make the nucleus. Now, pleomorphic, it has atypical nucleus, as we can see, and it is found in lymphocyte depleted. Okay, type of RS cells, classical. Again we will revise fatafat. So type is classical, then we have lacunar, then we have the polyploid or the popcorn one, polyploid type, and pleomorphic. This is seen in mixed cellularity and lymphocyte rich. Lacunar is seen again in one of the classical types, that is nodular sclerosis. Polyploid, it is seen in non-classical or the nodular lymphocyte rich, lymphocyte predominant. And pleomorphic, it is seen in again the one that is remaining. Okay, 1, 2, 3, and the fourth classical Hodgkins disease, that is lymphocyte depleted. So this is clear. How it appears? It appears owl eye appearance. It has owl eye appearance, and it is bilobed nucleus. Lacunar, there is a clear space around the nucleus. Polyploid, it looks like obviously popcorn shaped, we say, and it is large popcorn shaped. This, it is atypical nucleus. So that is all. So this is the revision is also done. Let us start with the classification. As I have said, the nodular sclerosis, mixed cellularity, what is it? We will see the specifics about Hodgkin's disease. The first one that we have here, so the first one that we have here, we'll talk about classical starting में. The first one is nodular sclerosis. Now there are few specifics of nodular sclerosis. There is a most common variant of Hodgkin's disease. Firstly, it is the most common one. It is equally found in female and male, and it occurs mostly adolescents and young adults. So it is not found in old people and all. It is mostly found in adolescents and young people, the nodular sclerosis. And it has excellent prognosis. Since it is happening in young people, the prognosis is good. Okay. And the RS cells are positive for, as I've said, CD15 and CD30. Epstein-Barr virus, it is negative. Obviously, nodular sclerosis, lacunar type of RS cells are present. The type of RS cells is also important to mention, that is lacunar type. When we see its histology, there is this thick bands, fibrous bands of collagen that we can see all over. So these are the collagen bands. These are the collagen bands. Then we can see there are a lot of lymphocytes. Nodular sclerosis mein there is a lot of lymphocytes that we can spot everywhere in the frame is this. Also, along with the lymphocyte, there is something called as macrophages. So how do these macrophages look? So we have these macrophages over here, all over. Now these macrophages will have a kind of a big nucleus, this. So you label that as macrophages. And also there is presence of something called as the, now lacunar है तो थोड़ा स्पेस भी रहेगा इसमें. So these are the lacunar type of. Let us label this fatafat. What is it? This is the RS cells, which is lacunar type. These are all of these. These are lymphocytes. This is the band of collagen. This that I've made, it is macrophage. All of these together form like a characteristic of nodular sclerosis. Let us talk about the next one that we have is mixed cellularity. Mixed cellularity, it is second most common, obviously, and most common in India. It has bimodal age, like it can happen twice, that is 15 to 35, or it can happen in people who are more than 50 years of age. The RS cells that are seen here are the classical type of, and it is positive CD15 and CD30. Also it is positive for EBV. Now let us see how it looks. Whenever we look at its histology, we can see big, firstly we can see these big round owl eyes, these kind of stuff. Okay, I just make two over here because I can't make a lot of them. So this is the owl eye appearance that I was talking about. These are the owl eye. So also there is, since this happens with cellularity, so we will have a lot of these infiltrates of neutrophils. It will have neutrophil infiltrates. So how to make this? These are neutrophil infiltrates, the PMN. Also there are histiocytes. So let us label one by one. Eosinophils are also present. Suppose this is eosinophil. This is neutrophil. This is what? Classical. It is have mixed cellularity. So it will have a lot of cells. Histiocytes. Since it is mixed cellularity, it will have a lot of cells. It will have some plasma cells also. And this is very important, that is the RS cell, classical RS cell. The third one that we have here is lymphocyte rich. Again, lymphocyte rich में what do we find? Lymphocyte rich we have classical RS cells. So first let's mention that classical RS cells are found in here. Then it is positive for CD15 and CD30. It is positive again for EBV, and it is more common in males and adults. Okay, older people may it is this. Also is it has a good prognosis. How does it look when we talk about the looks? This is, if we see the histo slide of it, classical this we will see classical, we will see there is presence of classical RS cells, the owl eye appearance, this, and a lot of proliferating lymphocyte, because it is lymphocyte rich. So there are lot of lymphocyte all around. All of these, that is we also say proliferating lymphocyte. These are obviously the RS cells. So that is all we see. We also see sometimes some histiocyte. That is enough. Now let us talk about fourth, that is finally lymphocyte depleted, in which there is no lymphocyte. The lymphocytes are depleted. So what will we see? This is generally seen in older males. Okay, and this is the least common type. Okay, there is like depleted lymphoma, but like there is presence of Hodgkins cells, so we consider it a lymphoma. But generally there should be this. That is why it has a pleomorphic RS cells. They're atypical. It is not typical, because generally in lymphoma there should be a mass. Okay, there should be proliferation of something, which is not seen here. So what is seen? We can see it is generally associated firstly with HIV, and what is seen is CD15 and CD30 positive. It has worst prognosis because the lymphocytes are very depleted, so the person becomes susceptible to all the infection. Anyways, the person is susceptible to infection, but in this situation it becomes more. How does it look? Okay, so now the histology. We see a lot of fibrin bands. Firstly, there will be large number of these big RS cells. Okay, the atypical type, the atypical ones, all of them. These are the nucleus, atypical one, all of it. So it is, we have made that. Once we've made that, also make these cells lymphocyte. Now lymphocytes are depleted, so they want to be more in number. There will be hardly any lymphocyte. What we can see is a lot of these fibrosis, and this fibrosis is not prominent, it is diffused. So we see, what do we see? We see a lot of diffused fibrosis. This, on the other hand, is pleomorphic RS cells, the atypical one. These are lymphocyte, depleted lymphocyte. And then we can also see some histiocytes. Okay? So that is what we generally see. The next type only, it is nodular lymphocyte predominant, also known as the non-classical Hodgkins disease. What do we see in the non-classical one? It is common in young adults. So till now we have seen this one lymphocyte depleted, which is common old male. Otherwise, lymphocyte rich is in adults. Mixed cellularity, it is it is bimodal, so it is generally in adults only, and sometimes it is also in people more than 50. Nodular, it is in adolescents and young adults. So there is only one. Depleted, it is in old people. Now nodular, it is also in adults or young adults, you can say. The characteristic is popcorn RS cell. Popcorn RS cells, they are also called as the polyploid cells, polyploid type. It is CD20 and BCL6 positive. It is negative for CD30 and CD50. It is also negative for EBV, and it has best prognosis. It can be cured. Whatever happens in young people, it is very curable, is what we have to remember. This is not this logic, but it's a trick to remember. Again, it is lymphocyte predominant, so a lot of lymphocytes will be seen. Let us make them. It is like this. Now these are the popcorn RS cells, lymphocytes, which are rich in lymphocyte. Clinical features when we talk about. Finally, clinical features when we talk about. Generally, they are painless. They are movable because they are present in lymph nodes. So generally, we can palpate them. They can be moved. They are characterized by lymphadenopathy, that is swelling of the lymph nodes. Splenomegaly. Since in whenever there is proliferation of unwanted lymphocytes, they will be destroyed in the spleen. So therefore splenomegaly is seen. Liver enlargement or hepatomegaly is also seen. The constitutional symptoms. Okay, the constitutional symptoms, we also call it as type B symptoms. Associated symptoms, basically. They are low grade fever because infection susceptibility is increased. We also call this as pale Epstein fever, low grade fever, not high one but low grade. Night sweats, and also weight loss because there is increased unwanted cells are produced at increased rate, so there is increased metabolism, so weight loss is seen. So this is all about the clinical features that you need to know. We've already talked about the tests that are the laboratory tests that we need, that is the EBV negative or CD15. All of these are lab diagnostically important. We're done with lymphoma as a topic. This is a short video. I hope this helps.